I'm with Grace Crickette. She's the Senior Risk Officer for the University of California, one of the largest institutions in the world, literally with a global footprint across multiple lines of business, far beyond just education. It's a very research-intensive medical practice and research facility and everything else, high-tech research, the whole works. Grace, wellness. What are you doing with respect to wellness programs to help keep your people healthier, drive down your healthcare costs, improve their quality of life and their productivity as members of your team?
Well, we are obviously in the healthcare business, and so we're big proponents of wellness. But our latest initiative, which is very strategic, and we are going to be able to show an ROI, which everybody knows on wellness, that always seems to be the challenge is how are you going to show the return on investment. So we're focusing on occupational injuries. And one of the reasons for that is that we have a great deal of data about our employees and how they're getting injured and what the nature and extent of those injuries are. And so for every employee at UC who's had 2 or more workers' compensation injuries, not necessarily even a claim, but just an injury, because some of them are first aid, all those employees are being offered wellness programs. One of the things that's great about being on a university is we have a great sport rec center with great sport rec trainers. We have therapists, we have dietitians, we have clinicians, and our students, they sleep in the morning. They take a long time to wake up, so we have these facilities that are pretty much empty in the morning. So we're kind of targeting.
That's interesting.
I know. So we're targeting that time to get our employees in who have had these injuries and offering them a 12-week targeted coaching program, really designing the program to meet all of their needs and treating them as a whole person. We're also going to be looking at their work environment and really just offering help. We don't want to see people having multiple injuries. We want them to be well, and we're tracking those employees because we already track them in the workers' compensation system, and we'll track their progress through the program and how it improves their lives. I want to mention we did do a pilot already. We did a pilot, it started 4 years ago. We put in 78 employees into this type of program at UCSF.
Were they all previously injured employees?
They were. They all had multiple work comp. And in 4 years since they went through the program, only one of them has had a subsequent work comp claim, and it was to a different body part than the one that they had. So hugely successful. We know that
varies greatly from prior statistics, I assume?
We didn't have prior statistics, but that was what we measured, and so this is actually a big initiative, also supported by our Senior Vice President of Health and Science, Dr. Stobo, and we're going to be using this as actually the model to then start to look to see, well, what kind of programs can we put in place on the non-occupational side. But we're starting at the occupational side because what gets measured gets managed, and we can manage this and we can report on it and really show that there is a good ROI. Okay,
but you do see the program expanding into non-occupational preventative health and wellness programs more aggressively?
Correct.
Going forward?
Right, and I also want to say that we do have at each of the campuses, we do have wellness programs that are not just targeted on occupational. So we have a lot of walking programs, a lot of nutrition programs. There's a lot of options for for all employees on the wellness, but this one's really where we're really targeting and really reaching out to those individuals who have had these injuries, and it's not mandatory, but just really trying to reach out to them and bring them in and help them to have a better life quality.
Right. Given the research orientation of your system, do you see yourself starting to help gather, warehouse, and then report the analytics of preventative so that it impacts future healthcare costs and health insurance and the like?
Right. I hope I answered this. I think what you're asking me is, are we really going to collect the data? And we have an enterprise risk management system, which has a business intelligence
because this will impact the private sector globally.
Right. So we're pulling
if you lead in this area.
Right. So we're pulling in detailed information from, it'll be from the claims system, and then also there's basic information will be reported in from the sports rec that says, this person, their BMI has gotten better, they've lost weight, they've quit smoking. So we're going to track that and track the outcomes. We're also going to track the people that we offer to and they say no.
Right.
And then to show well, then here's
That's one of the biggest problems in the
right.
private sector is, are we going to get an insurance premium deduction if we, in fact, participate in a wellness program? Right now, there's a disconnect there.
Right. So
in most respects.
So again, we've got programs for all employees, but this one's really going to be targeted and measured, and I'm really excited. About 24 months from now, we'll have some decent data to report out.
All right. Thank you very much, Grace.
You're welcome.
For your time. It's been great.
Thank you.